Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome to Bad to the Bones podcast. I'm your host, Debbie Rohde. Joining us today is Dr. Peter Sarkos, board-certified fellowship-trained hand and wrist microvascular surgeon. Dr. Sarkos specializes in hand and wrist surgery, including carpal tunnel syndrome, trigger finger, scaphoid fractures of the wrist, and common finger fractures. He treats conditions and injuries to the wrist, elbow, and hand. Also joining us today is Emily Morales. She is an occupational therapist with Premier Orthopedic Associates. Emily evaluates and treats patients with upper extremity conditions. She works closely with Dr. Sarkos' patients to develop occupational therapy that focuses on improving fine motor skills of the hand. Welcome to the show, Dr. Sarkos and Emily.
Thank you very much.
So let's get started, Dr. Sarkos. We want to know, we want to share a little bit with our listeners about your background, what really sparked your interest in this field.
So I became interested in hand surgery when I was young. Both my grandfathers lost fingers in construction accidents when I was a young child, and it was interesting to watch them recover from their injuries and go back to their jobs and work full duty.
Were they in the same line of work, exact
separate lines?
Same line of work?
No, they were in separate lines of work. One did auto glass and one did construction.
Wow, that's so ironic.
But both lost their fingers with table saws. So that's how it all started for me.
Okay. And at what age were you when that happened?
I think probably around 9 or 10.
Okay, so you had this vision for a long time.
A long time.
That's pretty interesting. And can you explain a little bit about what's involved in microvascular surgery, in these crucial procedures that you take care of with the hand and wrist?
So microvascular surgery is almost like a subdivision of orthopedics. We deal mainly with the very small blood vessels of the hand and wrist, from the level of the wrist down towards the fingers. These vessels and nerves require special training and special techniques to fix. We use sutures that are very small, often needing a microscope to suture the nerves and the arteries. In some cases, we use needles that are so small, if you take a penny, they fit within Abe Lincoln's ear.
Oh my gosh, that's pretty interesting. Wow. So what are some of the common conditions that you treat that need that type of surgery?
Most of the things that we see that require microvascular surgery are trauma, lacerations, car accidents, construction accidents, where there's some type of laceration or injury to the hand that disrupts either the blood vessel or the nerve that requires repair.
So with that being such an intricate, detailed type of procedure, are there some different techniques or innovative procedures that you stay on top of that you're excited about?
Medicine's always changing. There's new
Yeah.
techniques every day. We keep up to date in a few ways. We read the journal articles, of course. We go to conferences. And the main way I keep up to date is by teaching. I give lectures to both the Rowan medical students and in Spear residents. We have residents that are in their specialty years of training that spend 4 years with us in training, and they're studying to be orthopedic surgeons, and some of them are even studying to be hand surgeons. And they keep us on our toes because they ask really good questions.
Yeah, I'm sure. And so there's challenges we all have in our day-to-day job. What would be some challenges that you face?
Some of the challenging are just budgeting our time. A lot of these injuries come in spur of the moment, middle of the night. We'll have a full day of office hours, and then somebody will call 4 or 5 o'clock at night and have an injury, and we try to squeeze them in and get seen.
Yeah. And
then trying to get them on the OR schedule and get them fixed, it becomes very logistically difficult.
I'm sure. So if there is an emergent situation, are you on call for things like that? Or?
I take call. I take usually 1 to 2 weekdays a week and 1 weekend a month. But there's 2 hand surgeons, myself and Dr. Monahan in the group. We're the 2 hand surgeons. If any of my partners get a severe hand injury, they will call one of us.
Okay.
So we might be called in any day of the week or weekend to come help with a difficult case.
You've performed a lot of important surgeries and gotten people back to their quality of life. Is there maybe one case that really stands out for you?
There's a lot of cases that stand out. The cases that stand out are the patients that, they make it creates a life-changing event for them. I recently had a patient, it was their 1-year anniversary, and they sent us an edible arrangement just for the 1-year anniversary. So it was special, and it meant a lot to me, and just show their appreciation. And that's what makes it fun, is the patients that appreciate you and really come back and thank you later and go back to their normal lives.
I remember a case, the one woman where she made you all this bedding, like quilted.
quilt.
She was so excited
Yeah.
that you got her hands fully functional, that she could do something as
That was
detailed
her
as
goal.
that.
Her goal when she came into my office, she said, I just want to go back to quilting.
Yeah,
And I promised her. I said, I promise
Yeah.
you to go back to quilting. And
that
she
was
did.
really cool.
Yeah, she made me a quilt.
That
She
was
did.
really, really cool. And in Premier Orthopedics practice, it's very important that you all collaborate with each other to give your patients the best quality care. Can you tell us a little bit about what that coordination process looks like when a patient comes in and, they have to see different physicians?
So it starts with the operators. We have operators that answer the telephone. They're very good. They're trained to know what type of questions to ask for, to know how urgent a case may be, whether it needs to be seen that day, that week, or can be seen the week after. Our front desk staff is amazing. We have medical assistants that are well trained. Everyone knows their job and what to do, and everything's just very, very well coordinated.
Yeah.
And even down to our therapists. Our therapists are top notch. We have hand therapists that specialize in hand therapy. Everyone knows their role and what to do.
Well, that's a good segue to bring Emily in. If you could slide that microphone over so Emily can share some of her passion and her knowledge with us. What inspired you to get into this field of occupational hand therapy, Emily?
So my mom was a rehab director at Vineland, at a program there, and I did not want to do physical therapy. And she was like, don't do physical therapy.
Okay.
And I said, okay.
What's the difference?
Well, physical therapy I think is very biomechanical, and occupational therapy we think more in terms of function, functional activities of daily living. How do people complete what they need to complete functionally? Do we need to adapt what we need to do because we're missing digits? Because he cut them off. Or do we need to just compensate because we're not strong enough yet?
Yeah.
So.
Okay. So can you explain a little bit about how you and Dr. Sarkos work closely together?
Well, like he said, we have like a really great team that sets everybody up kind of for us. People get put on my schedule after they're done on his schedule. Usually his notes are pretty detailed, and his surgical coordinator does a great job of throwing people on my schedule. So I kind of know what to look for. And he's really a predictable surgeon, and he gives his patients a lot of confidence to get moving early.
That's great.
So I just really emphasize that a lot of the time.
What are some of the misconceptions, if any, that your patients might have when they, need to get hand therapy?
Why don't I feel better yet?
Oh, really?
Yeah.
Is that like after the first therapy session?
He fixed me.
Yeah.
And now I'm stiff,
Okay.
and this hurts.
Yeah. And so what would be a typical treatment plan then? The patient, I'm sure, understands what to expect. So what does a treatment plan look like for someone who just had surgery?
Depends. It depends on their procedure, and kind of everybody gets a protocol for the most part, which is kind of a guideline. So I usually am pretty thorough. I use my hands to demonstrate kind of what's going on, what they're going to feel, and how those feelings are going to change, because I don't take their pain away. Their pain changes. And then I kind of walk them through what the next couple weeks or just days might look like, because not everybody is with me for weeks.
What is an average length of time that someone goes to therapy after having microvascular surgery?
4 to 8 weeks is pretty standard, but again, it totally depends.
Yeah,
but most
sure.
people, we get moving really, really well by 8 weeks, no matter what the procedure is.
And how do you stay on top of some of the newest techniques and different therapies?
Well, I'm planning to sit for my CHT certification next year.
Nice.
I can't sit yet, but I have John, who's our director. He's a certified hand therapist, and Eliza, who is an absolute brainiac, and they know everything.
Great.
They're so smart.
So you have a great team to support you.
I have a
and learn
great
from.
team if I have any questions. Plus, the doctors are always available. They're easy to talk to.
What do
So,
you find is the most rewarding part of your job?
when people get better?
Yeah?
Yeah, when I
That's
get to say,
exciting.
see ya, don't come back.
Oh, that's so exciting. That's
But
really
same as
exciting.
Dr. Sarkos. They love to bring in like little gifts and stuff. It's really sweet.
That's really exciting. Let's throw it back to Dr. Sarkos. I'd like to kind of ask you the same last few questions. What are some of the things that get you really excited about your job?
I like seeing patients improve.
Yeah.
I really do. It's a long process. Hand surgery is very complicated.
Yeah.
The hand's a very complicated structure. That's why we have hand therapists.
Mm-hmm.
And the important thing is, and one thing I try to stress with patients is how important hand therapy is, more than any other surgery.
Yeah.
We have therapists who do the whole body. We have therapists who just do hands. And it's a coordinated effort, and when everyone does their role, patients do well. And to see patients come back to work and their life and their sports, their hobbies, that's what's rewarding.
So do you have a lot of people coming in, with all of us on our phones? I mean, do people come in with what is that, the trigger finger, or what is that called?
They get trigger
Your
fingers.
thumbs?
Yeah.
Are you seeing a lot of that?
There's a lot of it.
Yeah.
They recently did a study out of Europe that showed that 15-year-old girls spend more time texting a day than sleeping.
Oh my gosh, that's quite scary.
It's scary. And they're getting a
wow.
lot of hand issues, a lot of carpal tunnel syndrome, a lot of
Yeah.
trigger fingers, a lot of tendonitis, and we're seeing it all.
Very interesting. What type of advice would you give to aspiring surgeons interested in your field?
Start early. Start early.
Start at 9 or 10 years old, start studying?
Start early. My younger sister was in kindergarten the year I started pre-med. She graduated college the year I finished my fellowship. It's a long haul.
Yeah.
And start to try things when you're early. Get out there, rotate with some doctors, go to the office, see if you like it.
Yeah.
Because if you don't like it, it's a long 17 years. But if you love it and you like what you do, it goes quick.
So was there a time during your studies that you decided or thought maybe you do want to change fields but stay in orthopedics?
I always wanted hand. I always
Yeah.
loved orthopedics. When I was in high school, I worked as an orderly in Atlantic City Medical Center, mainland division in the OR.
Nice.
And I liked medicine. I loved medicine, but I didn't know what I wanted to do.
Yeah.
And one of the orthopedic surgeons there, Dr. Fox, kind of took me under his wing and invited
Shout
me
out
to
to
the
Dr.
OR.
Fox.
Dr. Fox, he's retired now.
Okay.
But he took me in the OR and handed me a drill and said, I'm going to teach you how to operate.
Yeah.
And I left that OR that day and I said, orthopedics.
That's so
I
exciting.
never looked back.
That's great to know what you want to do at that stage of life and just follow through with your passion. That's a really beautiful thing. Dr. Sarkos, can you share a little bit about, maybe let's talk about the top 3 non-traumatic hand conditions that you treat?
So the number one is definitely going to be carpal tunnel syndrome. It's the most common surgery performed in the United States. I probably see 20 to 30 cases a week of carpal tunnel syndrome. And the first question I get is, what is carpal tunnel syndrome?
Yeah.
So carpal tunnel syndrome is a condition where the median nerve, or the main nerve that goes to your hand, becomes entrapped in a small tunnel within the palm. When the nerve gets entrapped, it can no longer get blood supply and it starts to die. You start to get symptoms like numbness, tingling, pain, and weakness. Most of the symptoms are first thing in the morning or at nighttime.
In the entire hand, or
In
just
the entire hand.
Oh, wow,
Mainly
okay.
your thumb, index, and middle finger, but in
Okay.
some cases, depending on the exact distribution of the nerve fibers, it can be the entire hand. We usually diagnose this with an electromyogram or an EMG. The EMG is a computer test that basically determines the velocity at which the nerve fires, how quickly the brain sends a signal to the hand to move the fingers.
Okay.
Based on that number, we determine how severe the carpal tunnel syndrome is. Treatment can range from observation to conservative management like nighttime braces to surgery.
Mm-hmm.
Two of the issues with carpal tunnel syndrome is, one, it's a progressive disease. It typically only gets worse with time. And the more important factor is it can be permanent if left untreated.
Oh, wow.
So a lot of patients come in and we get an EMG and there's already partial permanent damage to the nerve. I make it very clear to the patients that they may not make a full recovery with surgery. We still perform the surgery because there's a great chance they will make some recovery,
Yeah.
and also it will stop any progression or further damage.
Okay.
The surgery itself involves about a 5-minute procedure.
That's it?
That's it. We make
Wow.
a small incision in the palm, we decompress the nerve and stitch you up. You get a small dressing afterwards. The only restriction after surgery is keeping it dry for approximately 2 weeks before the stitches come out in therapy. They can use it the next day with no restrictions.
Gosh, that's interesting because I remember years ago my sister-in-law had carpal tunnel surgery. She couldn't even go to the bathroom by herself. And so things have changed
Things
in
have
like all
changed
those years.
significantly in the last
She
10
was
years.
bandaged for weeks.
Yeah, they've realized that the issue with carpal tunnel or any hand surgery is if you immobilize it unnecessarily, you make scar tissue.
Wow.
The median
okay.
nerve runs through that carpal canal will so that the tendons that flesh your fingers. So when you release it, there's an inflammatory process that starts immediately.
Okay.
If you do not move the fingers immediately, you will make scar tissue and get stiff. So they learned over the years that it's better and patients progress much more rapidly through the healing process if we move them quickly.
I would think that that's a pretty common, I mean, especially, I type a lot all day. I mean, what does it stem from? How do you get carpal tunnel
The
syndrome?
jury's still not out.
No?
There's
Okay.
even studies out of Europe that show typing now prevents it, which
Interesting.
I don't know if I believe, but
Yeah.
there's all types of studies right now, and they really don't know. All we know for now is that it's an issue with the nerve fitting in the canal. Either the canal is too small for the nerve, and the nerve's too big for the canal. What is interesting, and they're doing a study up in Connecticut where I trained, is the rate of carpal tunnel increased significantly once keypads became available to the public.
Huh.
So the days of typewriters, you hardly ever saw carpal tunnel. But once we
Okay.
came out with keypads, you started seeing it. At first, we didn't see a correlation because typing's typing.
Yeah.
But if you think how you type with a typewriter, you're using your wrist.
Yeah.
With a keypad, you're using your fingers.
Yeah.
The tendons that control the wrist do not go through the carpal canal,
Huh.
where the tendons that control your fingers do.
Okay.
So there may be a correlation between typing on the keypad and carpal tunnel
So
syndrome.
do you see more females than males?
I see equal.
Okay,
Equal.
that's pretty interesting.
I have patients that don't know how to type that have carpal tunnel.
Yeah, I mean, most men I see are like hunt and peck typing. They
Mhm.
don't type so well.
Correct.
Oh, that's funny. So is there another condition that's non-traumatic that you see a lot of?
I see a lot of arthritis,
Okay.
especially in women more than men, especially thumb arthritis. We call it CMC arthritis, which stands for carpal metacarpal joint arthritis. Usually starts around age 40, and it progresses. Patients come in with what we call basilar thumb pain or pain at the base of the thumb. Usually we diagnose it with just a plain x-ray.
Okay.
Treatment can range from observation to braces, injections, or surgery. The surgery to correct this condition is called a CMC tendon arthroplasty. It's a very unique operation. It's one of the few reconstructive procedures we do in the body where we do not use any implants. So there's no screws, no plates, no wires, nothing. The benefit is there's nothing to reject. Some patients have rare allergies to alloys, so we
Okay.
do need a hip replacement. They have, like for example, a nickel allergy. There's nickel in a knee replacement. The implant has to be taken out and a new one has to be ordered. Or they wear out. Some of the polyethylene in knees or hips, they wear out after 10 to 15 years. Where with this procedure, it is your own tissue, so they last forever. There's no chance for rejection and there's no chance of it wearing out. So once it's fixed, and it's a pretty rapid recovery. You're in a brace for about 3 weeks, and then Emily starts therapy with you. Therapy ranges from 6 to 8 weeks. But patients get full strength, full motion, and it alleviates the pain.
And so after Emily releases them, do they come back to you for a final okay? And
They do.
Yeah.
They do.
Yeah. So you are a teacher today. You teach up and coming surgeons. Who inspired you to, during your training? Is there any particular person that inspired you?
I had many patients, professors and teachers that inspired me. I guess one of them is Dr. Dwyer, who's my partner.
Yeah.
He was one of my mentors and got me very interested in orthopedics. He trained me and we worked together. As far as hand surgery, I was very fortunate to do my hand fellowship in Connecticut with Dr. Kirk Watson. Dr. Watson's a world-renowned professor and hand surgeon. There's many procedures done throughout the world today that he invented. And I was lucky to spend a year with him in training.
That's fabulous.
Dr. Watson was trained by Dr. Joseph Boys, who is one of the world's most famous hand surgeons. So I was privileged to train with him, and he taught me a lot in just a year.
What makes a doctor the world's most, how does someone distinguish that? Is it just the outcomes?
There's a lot of factors. Dr. Watson has, a couple hundred publications. He has invented or discovered multiple procedures that are done routinely throughout the world. One of them is called a four-corner fusion, which he invented, and I perform probably 4 or 5 a year.
Okay.
But it's done throughout the world. There's conferences that we go to that are named after him. He's
That's
operated on
really cool. Yeah.
I don't know how many pro athletes and celebrities. When I did my fellowship, they would fly in from all over the world. We would operate on them, so it was exciting.
And most of the patients that you see, are they just everyday average people, or are they work injuries?
They're both. We have a combination of both work comp injuries, athletes, and just everyday patients.
Yeah. That's good stuff. And Emily, when these patients need therapy, can you share a little bit about some of the most important things that you share with the patient as they go into hand therapy?
Yeah, so we have a really solid post-op protocol for a lot of Dr. Sarkos' regular surgeries like he just talked about. For instance, his carpal tunnel procedures, they follow up with me 3 to 5 days post-op, and that is told to them as soon as they're scheduling surgery. His surgical scheduler puts them right on my schedule. So they're in to see me after surgery before they even see him. We're getting moving, we're getting unwrapped. I'm talking them through what to expect in therapy. It's uncomfortable. I do a lot of explaining with my hand because we have a lot of different feelings and they're not all great.
Yeah.
But like he said, with carpal tunnel there are no restrictions besides keeping that incision dry and clean. So I'm just reiterating that because there are a lot of feelings. Some people are really scared if it's your first procedure, it's your first time waking up from being under, and you're seeing a couple sutures in your hand. It doesn't feel good.
Right.
I'm just there to reiterate, like, everything's okay. We're going to get moving. The
You're
more you move,
basically
the
just
better you can
managing
feel.
their expectations and
Absolutely.
taking the fear out of this whole process,
Yeah.
right?
Mm-hmm.
What would be some of the major fears that people are having? Is it they are feeling different pain along the way and they're not sure that they should be feeling those things, or?
Yeah, because it's a different kind of pain. They
Yeah.
were used to a certain type of pain with these non-traumatic injuries. They're living with pain every
Yeah.
single day, and then they expect the surgery to take that pain away. And it might take that pain away, but now a new pain is there, and they're like, wait a minute, what happened?
Yeah.
So I'm just like, everything's normal, and everything's going to be fine. And the more you move, the better you're going to feel.
Yeah.
And if you don't, we're both going to get in trouble.
By
in
the
4
big man
weeks
over here.
From the
So what
sky.
are some of the advantages of the patient, of Dr. Sarkos' patients, moving right over to you and seeing, coming to Premier's hand therapy versus, just deciding to do it down the road somewhere else?
I think it's very seamless because I've been very well versed in his post-op protocol from Eliza and John, and even Rachel down in Violin. We all just know what to expect. We know what's coming in, and it's very easy to get in communication with Dr. Sarkos. If they're in Elmer on Wednesdays, we're going to see him. If they're with me on a Monday, we have the other hand surgeon there. Like, God forbid something goes wrong. We have doctors in the office, and they're
Yeah.
really easy to communicate with because we all work in the same system.
Yeah. Do the doctors ever pop their head in when a patient's doing therapy, or is that kind of completely separate?
Oh, yeah, definitely.
Yeah.
Yeah, the office I'm in has physicians in there 3 days a week, so, and they're nosy. They want to see what's going
Yeah,
on.
of course.
They like to check on their patients.
Yeah, so I was going to ask as well. So if someone's got an 8-week therapy session, do they, in the interim, stop in to see Dr. Sarkos to see how it's going, or is it just, we don't see you again, really, and check you till you're done?
It usually depends. They'll have some type of post-op follow-up with the physician, whether it's Dr. Sarkos or whoever, and then they will follow up usually in 4 to 6 weeks because their scripts are usually 4 to 6 weeks with us, and then they get a new script, and then we continue our therapy. And unless I feel like they're good to go and we're meeting all of our goals and they're pretty functional and their pain's much more manageable, they'll check in with them at some point again before they're finished.
Can you take us through maybe just 2 of the therapy exercises that you do for a carpal tunnel surgery patient?
All my
'Cause that
patients
would be exciting to know.
like my tendon glides. So we start nice and straight, and this is always a good stretch after carpal tunnel because we like to rest in a resting hand position.
Yeah.
So nice and straight, and then I like to curl down into a hook fist first, and then down into a full fist. This is usually pretty tight.
Okay.
And then I like to start our second tendon glide nice and straight, and then come into a tabletop position and down to a flat fist. As Dr. Sarkos mentioned earlier, our finger flexors are also our wrist flexors, but they come through that carpal tunnel, so they are very tender and sore.
Yeah.
So just making a fist after this procedure is our first goal.
I'm sure.
Other than that is opposition or thumb to fingertips.
Okay.
Our goal is to get down to the distal palmar crease, which is that line in the middle of our hand. So by the time they follow up with Dr. Sarkos, he expects a full fist, completely straight.
Yeah, so he's judging
And
you on your
opposition.
performance, how well you got that
Yeah.
patient to have their mobility back. What when someone gets their full mobility back, what does that look like for them? I mean, can they just go home and open the top to a bottle with ease, or
Well, it really depends. Motion comes first and strength and endurance comes separate. So we're working a lot on motion because if you don't have the motion, it's like doing half of a bicep curl. So we spend the first couple weeks, if necessary, working on motion. As soon as they have the motion they need, we really start to push for strength because that's when opening a jar of peanut butter is challenging.
Yeah.
Especially if they are a little bit more severe. They have let this kind of linger, then they are going to be weaker. The first muscles that go weak in the hand with carpal tunnel are our thenar muscles, which are our thumb muscles. Our thumb is what separates us from all the other mammals in the world, so
Yeah.
all those pinch positions are tough.
Wait, I think my dog has a thumb, doesn't he? I don't know. I thought he did. What is one of the most rewarding procedures that you perform therapy for?
I feel like our wrist fractures, they always do fantastic, and they're always on a tee. They kind of all follow. We we have pretty good expectations for everybody, and I spend my first session talking too much and over-educating.
That's good, though. That's not a bad thing.
Yeah, when I go, do you have any questions? They always say no.
That's a great thing, because then it means you've already answered them before they ask.
Yeah, I try to, just because there is a lot going on,
Yeah.
and nobody's doing this because they want to, right? So I spend a lot of time educating people on what their timeline's going to look like so that I can manage their expectations.
Yeah.
But I think our wrist fractures are our protocol's pretty clear and pretty clean. They're
Well,
in and
you
out
have
in
some
like 8
great
weeks.
reviews on our Facebook page when someone comes in to see you and
Oh,
checks in, so that's all
patients
good
are so
stuff.
nice.
Well, that's all the time we have for today. We're really grateful that Dr. Sarkos and Emily were here with us to share a little bit of insight on hand and wrist microvascular surgery and hand therapy. If you or someone you know is suffering from chronic hand conditions, don't wait to be seen. Even elbow pain, don't wait to be seen. Call or text us today at 856-690-1616. We have 12 locations across southern New Jersey in Camden, Gloucester, Salem, Atlanta County, right? And our newest location are within Spiro Health Center on Almanesson Road, the old Dick's Sporting Good across from the Deptford Mall. So that's it for today. We really hope that you join us on our next episode, and in the meantime, stay healthy.